Dr. Demian Glujovsky is a reproductive endocrinologist working in the field since 2005. Based in Argentina, Demian has extensive experience with international patients. As a senior researcher, he conducts systematic reviews and produces health technology assessment documents and has published more than 50 papers in peer-reviewed journals. Dr. Glujovsky is a member of several editorial boards and is director and founder of Fertility Argentina. Welcome to Pure Health Hub, Demian.
Thank you. It's my pleasure to be here. Thank you for this nice introduction. My last name is actually Glujovsky, but it's okay to say Glujovsky.
And we did talk about this before, but I thought I'd struggle even more with that. So thanks for clarifying. All right. So tell us, Demian, now we met a little while ago during the launch of MediTrav, which is moving people around the world for medical treatment. So, and of course, I discovered what you were doing over there was significant, and particularly for Australian people looking for IVF. So I just want to ask you a little bit more about that. Now, IVF and assisted reproductive technology is one of modern medicine's greatest achievements. Since its introduction in 1978, IVF is now considered to be an efficient and safe procedure and has become more accessible and affordable in recent times. Not necessarily here in Australia, but certainly available around the world. So let's get started. Now, who does make a good candidate for IVF? What are some of the conditions and circumstances people have that makes them eligible for IVF and equally ineligible?
Okay, that's a good question, and it's a good start. So first of all, we have to talk, well, we know there are different type of patients. So nowadays we have heterosexual couples, but also gay couple, lesbian couples, and also single mothers and single fathers. So IVF could be a good option for those that do not have a couple. IVF is a good option for those that are same-sex couples, and IVF is a good option for those heterosexual couples that keep trying for a long time. It means more than 6 months when women are over 35 years old, or more than 12 months if they are below 35 years old and they do not get a pregnancy. Some people start with an IUI, with an intrauterine insemination instead of IVF, and that's good because it is cheaper and simpler, but it is also less effective. So many of these patients quickly decide to move to IVF, or from the very beginning, they skip the IUI and go to IVF because it is more effective. If I should mention a few items that could make more important to go direct to IVF, it could be the age of the woman. I mean, those patients where the woman is over 40, and eventually when it is over 35 years old and they have been trying to conceive and they couldn't make it, it is a good idea to jump directly to IVF. A second reason could be sperm analysis that shows a very abnormal shapes, or the concentration of the sperm, or the motility. So when that abnormalities are important, so it is also a good idea to go directly to IVF. And also for those women where the ovarian reserve is diminished. So when there is a low ovarian reserve, we don't want to waste time with an IUI. We want to go directly to IVF. Of course, for those using donor eggs, IVF is the main type of treatment. And when I talked about single fathers, or a couple, or a same-sex couple, especially for men, IVF is a must. So these are some of the indications why to go to IVF.
Yeah. Now you do offer egg and sperm donation, but does Argentina permit surrogacy options?
Yes, Argentina permits surrogacy options, and it is pretty safe to do it in Argentina. It is legal, and in the last 5 years, we've been having more and more surrogacy treatments. And I should say that in 2022, it is the boom of the surrogacy in Argentina. Many patients from all around the world are coming to Argentina because they have the opportunity of doing an embryo transfer to a gestational carrier in Buenos Aires and have birth in Buenos Aires and receive the birth certificate in the name of the intended parents. So yes, surrogacy is a more affordable option than in some other countries like in the United States, and very effective, legal, and safe. So yes, it is a good option.
Yeah, it is, because of course it's not legal here in Australia, unless it's an altruistic option. But so is it fairly readily available then? If you say it's boomed and it spiked the interest, so is it fairly readily available?
It's available. So let's say if any person comes to me today and says, okay, I need surrogacy, let's say surrogacy with egg donation or without egg donation, both options are okay. I guess that in less than, 3 to 6 months, we are doing the treatment. So it is really quick, really quick. If it is with own eggs, it is quicker. If it is with donor eggs, it is still very quick. But yeah, we can do it and very easily.
Yeah, okay. And of course, I need to add a disclaimer there because I'm not familiar with the Australian immigration details in terms of bringing your baby home, but I'm sure it has been done, so it's available to them. So now,
yeah, sorry to interrupt you. In terms of the legal part, of course, I am a doctor, so I will not talk about the legal part, but before starting, of course, we require a legal counseling. So there are a couple of agencies working here in Argentina. They provide a legal counseling with an attorney and the agreements that they have to sign, and also they found the gestational carrier, and then we provide the medical procedures. So in terms to know exactly how this is for the Australians, that is what the attorney will tell those intended parents how to do it and if they can do it.
Yeah, and I guess they would also need to get advice here in Australia for obviously when they're returning the right paperwork. So, but it's good that you've got that support there locally, so that there's, that's an additional service, obviously. So that takes a lot of the weight off new parents. So,
sometimes, sorry, talking about the local attorneys or legal support. Yes, sometimes or many times the Argentine attorneys get in touch with in this case, Australian attorneys, just to be on the same page with the requirements.
Perfect. Okay, that's good to know. That's really good to know. So now there's a lot of talk, obviously, about women in the 40+ age group. What are the risks for women in that 40+ age group for undertaking IVF?
Well, I should say that women that are 40+ age have an increased obstetrical risk. It is not a risk related with the IVF per se. Of course, doing an IVF with own eggs over 40 years old is, the chances of success are lower, much lower, but it is possible. For most, they finally decide to go to egg donation. and that is a very, very effective option, and that is what we have been doing for a long time with Australian patients coming to Argentina for egg donation. So it is really easy, and it works pretty well. Regarding the complications or the risk at that age, okay, that is important to be counseled by an obstetrician to know that there is an increased risk of hypertension, an increased risk of diabetes, among others, that again, I prefer not to be the one who do the counseling about this. I am an obstetrician, but I've been working in IVF for a long time, so I prefer that is counseled by the obstetricians. But still, what I can tell you is that it is something that is performed every single day, and that for those people living in a big city with an obstetrician or with a clinic that is close, and risks are really not high enough to say, well, I don't want to go ahead with a treatment or with a pregnancy because of these risks. They exist. People have to know, patients have to know that they exist, but it is more like to understand what are those things that if happen, I have to go to call my doctor to see what I should do, and not just to say, I don't want to go ahead with this.
Yeah. It's obviously the monitoring, as you say, we've got a great medical system here as well. So, as long as they're monitored, there's probably no as much a risk, I guess, as anything else.
Yeah.
What is Fertility Argentina's success rate?
Okay, the success rates depend mainly on the age of the eggs. So I cannot tell you one specific figure about it. I can tell you that for egg donation, which is it is easier to talk about the success rate in egg donation, because it doesn't matter if the patient is 25, 35, 45, or 50, the success rate is exactly the same. So the clinical pregnancy rate is over 6, it is between 60 and 65%. So that means that almost 2 every 3 person get pregnant in the first attempt. But also, if they decide to do it with PGTA, that stands for preimplantation genetic testing for aneuploidies, that means biopsying the embryos, testing them, and then transferring only those that are chromosomically normal. So those success rates rise to 70 to 80%. So it could be very, very effective. In terms of own eggs, it depends on the age. It is around 35% when women are 35 years old, and more around 20% when they are 40 years old. And then when they are over 40, as you can imagine, the success rate drops really quickly. But yeah, we have nice rates.
That's strong success rate though, right? Especially with the egg donation, that's really strong. Okay, then
we are happy. And what I like to tell my patients, and that is, I think is very important, I like my patients to think in mid-term objectives, not short-term. Even when it is 60, 65%, which is really high, it means that 35 to 40% of patients will not get pregnant the first time. So, and that is not very low. So I prefer my patients to understand that they could have they could need to try maybe more than once, and sometimes maybe more than twice. That is not the most common, but that could occur. So it is very important to think in midterm.
Yeah, of course. Okay, then, so why would people travel to Argentina to undertake IVF as opposed to have it here in Australia?
Okay, yes, that's true. And probably it is really good. I know lots of very good doctors there. It's not that it is better here in terms of effectiveness. It is that especially for egg donation and for sperm donation, but especially for egg donation, waiting list or waiting time in Australia is usually long. It is not easy to find a donor for each patient. So coming to Argentina makes it very, very simple. And that's why lots of Australian patients go abroad to go for egg donation. So that is what we have been doing, just helping those patients that do not want to wait a long time, that they could get pregnant. If they can do it in Australia, that is perfect, and it works really, really well. But for those that do not want to wait a longer time, coming to Argentina is just making 10 days trip, and this is it. In some cases they prefer to come twice, so the male partner only a couple of days, and he brings the sperm sample, and then he leaves in the country, and 3 or 4 months later the woman comes to do the frozen embryo transfer just for 1 or 2 days. But the other option is come both together for 10 days. They stay here. We do the fresh egg retrieval, the frozen embryo transfer, and they go back home and they have the pregnancy test in Australia. So usually my Australian patients tell me if they got pregnant or if they didn't.
Yeah. Oh, that's 65, almost 65% of good news.
Yes, yes. And what it is impressive is when I've been to Australia, I don't remember if it were 4 or 5 times. I give some talk to patients there. And whenever I go, I have 2 or 3 former patients coming with the babies just to show me, to introduce those babies to me. That is impressive.
Oh, I bet. How wonderful. How wonderful. And I guess the next question really was about the process. So there's obviously medications, there's an element of testing and medications required to take prior. So what is the process if they're leaving from Australia? And just going back a little bit, sorry about that, but I guess it's also much more cost effective to get IVF in Argentina, right? I know it's getting more expensive here.
Well, yeah, okay, the medication, when we talk about egg donation specifically, the medication is simple because it is just eventually contraceptive pills just to organize the cycle and to synchronize with the schedule that we need for the trip and the egg donor. And then some oral estrogens, which is also simpler, just a few days, a couple of weeks taking oral estrogens. And finally, vaginal progesterone when they get to Argentina. So they have to buy in Australia just oral estrogens, contraceptive pills. They usually need the help of a local doctor for these, but yeah, there are a lot of local doctors that help with this. And then a couple of ultrasounds and blood work to do the monitoring, just to check that endometrium is good enough, is thick enough, if is prepared for the embryo transfer. So we don't want any patient fly to Argentina without knowing that the endometrium is ready. So once I know that endometrium is ready, okay, they take the flight, they come to Argentina, we do the egg retrieval, the egg allocation, the IVF, and the embryo transfer once they are here.
Yeah, so it's a well-oiled machine between Australia and Argentina, right?
It is, yes, a well-oiled machine because we've been working on this for more than 15 years now. So yeah, we learned how to do that. We learned how to help our patients to have a detailed schedule, what to do every single day. So yeah, I feel that they feel comfortable with the whole process.
Yeah, yeah. So okay, there's this term called 3 and 5, and it comes back to this process. What does 3 and 5 mean? Keeps coming up all the time.
Okay. When we do an IVF, that is day 0. So day 1 is the day following the IVF, day 3 is 3 days after that, and day 5 is 5 days after that. A blastocyst is an embryo that gets, the embryo gets to the blastocyst stage on day 5 to day 6. And there is good quality supporting an embryo transfer on blastocyst stage. And that is better than transferring on day 3. Not all the embryos get to blastocyst stage. So 50% or even more of the embryos get arrested from day 3 to day 5. So we don't want to transfer an embryo on day 3 that we don't know if it is going to get arrested 1 or 2 days later, because I already did that embryo transfer. So I prefer not to do it, to wait 2 days more. I will probably have a lower number of embryos to transfer, but those embryos got to blastocyst stage. And at that moment, I have a higher chances of implantation and success rates. So we have good quality evidence supporting the blastocyst embryo transfer. 10, 15 years ago, the embryo labs were not so prepared to push the embryos from day 3 to day 5. So at that moment, when your embryo lab is not prepared for that, and it eventually could occur nowadays in some clinics, and that's fine, because not everybody can have that embryo lab to push the blastocyst stage. So in those cases, it is perfectly well to transfer on day 3. So when you cannot go to blastocyst stage, or when it is not safe enough, you should transfer on day 3. But if you have an embryo lab that is prepared to go to day 5, what you should do, because it is better, it is more effective, is to go to day 5 to blastocyst stage.
Okay. And obviously we can do that in Argentina.
We can do that. We've been doing that in our clinic since 2015, and it was a big change. So up to 2014, we used to transfer on day 3 because our embryo lab was not prepared. And we made huge changes in the embryo lab between 2014 and 15. And when we did it, we started transferring on day 5. And from 1 year to the following one, we increased the success rate 10%. So that is amazing. That's a lot. I can remember, we went from 52% to 62%. That only is related with the stage of the embryo transfer.
And you've been at this cutting edge of IVF technology, haven't you, for many years?
Well, it is important, that the IVF is very technologic, and we have to be prepared for the changes in the embryo lab. We doctors have to change every year with the new information, and we have to keep studying and reading what are the new things that we want to implement, to change in our clinics. So yes, it is interesting. It is nice.
Yeah, it's nice that it continues to evolve, and it's such a wonderful thing to be able to bring people such joy. Now I'm going to flip you into the travel agent a little bit. So what are special visas or travel hotel arrangements that need to be considered for people undertaking this journey?
Okay, everybody can, Australians in this specific case can come to Argentina. They need, as far as I know, they need a visa. Many come with tourist visa. Some prefer to come with a medical visa. That is up to them, of course. I cannot make a special or give a special opinion about this. But anyway, what they have to do if they want to come is just contact the Argentine consulate or embassy in Australia, and they will tell them what to do. If these patients, they will contact us before contacting the embassy. So we will guide them how to do it. In any case, tourist, medical, whatever visa they obtain, it is usually very simple. 10 days, 20 days, they obtain it, and they can come to Argentina with no problem.
And do you recommend they stay close to the clinic, or are there sort of nicer parts if they're going to be not spending that much time at the clinic? Are there nicer parts or, pretty places to stay?
That is a good question, because almost everybody asks me where to stay. And most people think that staying close to the clinic is the best option. I should say that it is not the best option, just because they will not have to come to the clinic a lot of times, just 1 or 2 days, no more than that. An hour every day. So my recommendation, if I were someone from abroad coming to Argentina, to Buenos Aires, is to stay in a nice neighborhood. We can give them some give a piece of counsel about this. They're unfortunately for us, Argentine currency is not doing well now. So it is really cheap to come to Argentina, to stay in Argentina, to eat good food in Argentina. So staying close to the clinic is a possibility, but as the clinic is close to downtown, it is a good place to be during the day, very busy, a lot of people working, but during the night, is kind of more empty place or neighborhood. So my recommendation is to stay like with Airbnb in a nicer neighborhood, go out in the night. Buenos Aires is very safe for that. So go to a nice restaurant, walk around, and just come to the clinic. That is 10 minutes away, 15 minutes away in a taxi car.
Yeah, much. I mean, there's place with no CBD, I don't think, in the world, apart from maybe Manhattan, happens at night. So that's good advice. Dr. Demian, thank you so much for joining us on Pure Health Hub. It's been enlightening, and I know it is such a topic for many people, and they're looking for ways to be able to start a family when they need assistance. So thank you, and it's nice to know Argentina is a wonderful opportunity, a wonderful option for people. Thanks, Demian. It was great to see you.
It's a pleasure for me. Thanks for giving me the opportunity of talk about what I really like, that is the IVF, the infertility treatments, and about Fertility Argentina, that has been working for a long time here. So thanks again.
Pleasure. Great to see you, and hopefully see you out here in Australia when you come out next, now that the world is finally opening up.
I will go probably next year.
Perfect.